Hello and welcome to this week's episode of Let's Get Vaccinated. In case you don't know me, my name is Lucky Tran and I'm the Managing Director for March for Science and I work as a science communicator in public health. So there are two things we should focus on this show. And one is that we help answer your questions about vaccines and public health. And two, we teach you all how to talk about science effectively because sharing knowledge is how we keep our communities safe. This is a community-focused show, so please don't be shy. Please do post your questions and comments in the chat because we really love the interactivity and sort of helping answer your questions. And it really gives us feedback on what we should talk about. So please say hi in the chat right now if you're present. And please don't forget to subscribe to our YouTube channel so that you can stay in touch with our community. Let's get this show rolling. I'd like to welcome to the show Interim Executive Director Rania Batrice. Hi, Rania.
Hi, how's it going?
I'm good. How are you doing there in Texas at the moment?
We're warm again, so that's good. The snow is gone, that's good, but still lots of recovery happening. And there are actually still some parts of the state that don't have drinkable water and things like that. So it's definitely an ongoing process, but I am good and safe. So that's good.
Yes, it's all about safety these days and helping fight for each other's safety and protect each other. That's what it's all about. So, we take things one step at a time. And today we are talking about that theme, right? We're talking about this idea, this concept of vaccine equity. And, we're at the point of the pandemic, which is interesting because there's been such an incredible worldwide scientific effort to accelerate and develop these wonderfully safe and effective vaccines for COVID. And, we have several of them that work really amazingly. But, despite all of the huge scientific progress, we have a problem, right? What good are vaccines without vaccinations? The question that we really have to ask is, are the vaccines getting to the most vulnerable people who need them? So that's something that we're really worried about at the moment. And we'd really like to chat today about it. So I think one of the most stark places where this is playing out is in Palestine, right, Rania?
Yeah, definitely. I mean, we're seeing it across the United States, quite frankly, and in other parts of the world, and Israel and Palestine are no exception. Unfortunately, there's a lot of misinformation and disinformation, as there is, and as there has been and now we're beyond a year, and we've been trying to tackle the misinformation, disinformation. Unfortunately, it has continued, and the thing that's really upsetting and infuriating, and all of the emotions about it is, we're not just talking about human rights that are being carried out against Palestinians. That's part of it, of course, but this a public too. We don't know about a lot of things that we do know, and we do know that there's no such thing as borders with this pandemic. So even if we put the human rights aside, if we're not vaccinating our communities, everyone's still at risk. And so and again, there's no exception when it comes to Palestinians. Unfortunately, the access is being limited, if we're being nice about it, non-existent in a lot of cases. And then you have the leadership, Netanyahu specifically, saying he wants to ship extra doses to allied nations, and meanwhile the citizens and Palestinians are still not getting vaccinated. So it is a public health crisis. It endangers everyone. And I just think, whether we're talking about Israel or we're talking about anywhere else in the world, the United States or anywhere, we have to be honest about this, because we are all citizens of this planet, and it's never been truer than right now.
Absolutely. And I would love to hear, because you're Palestinian, you have family, you have many loved ones there, to sort of maybe take a step back and sort of talk about your experiences and what you're hearing on the ground on the impact that the pandemic has had in Palestine over the last year.
Yeah, so it's been really unfortunate. And, again, these are ongoing atrocities that are very similarly to other parts of the world. And again, the United States, it's like, it's not new, but the curtain has just been pulled way back. So when a group of people are not afforded access to medical attention and medical care, which as has happened so egregiously in occupied territories and beyond, it's not like that is a new phenomenon, but it is again and it can't be ignored. And so I just like you said, Lucky, I have family. I saw family there. I have lots of friends there. Some of them are in the territory, some of them are not, and some of these abuses are being carried out on both sides of it. So it's not even like you can say, oh, you're behind the wall and so your access is limited. No, it's happening on the other side as well, which quite frankly it shouldn't even matter, because the risk is what it is. It doesn't change whether you're on one side of a wall or another. And just as we are experiencing here in the United States, there is a disproportionate effect on the Palestinian community, and it's very it's egregious. It's hard to ignore, but unfortunately a lot of folks have been, and it's really upsetting. I'm just going to speak personally now. But I also think there's a medical component to it too, and a public health component to it too. It's really upsetting when a country is pointed to as a success when they're continuing to leave behind and abuse already marginalized communities. Again, and it's not just Israel. It's happening in Black and brown communities here in the U.S. as well. But we keep sort of seeing this, these fingers being pointed to Israel as some kind of an example of what we should all be striving toward. And maybe they are doing some things well, but you can't point to something as a success when the marginalized communities are just being left further and further and further behind.
Right. I think that's a really interesting point, particularly for us as movements of scientists and science advocates, is that narrative, right? Because something that I'm seeing all the time is that Israel is ahead on vaccinations, right? And we're getting all of this data, all the early data is coming out of there. I think they actually signed an agreement with Pfizer, which is partially white, to share data, which is why they got access to the vaccines first. But that's only part of the full picture, right? And so it sort of frustrates me, right, this idea of what's coming out of there, because science really, it's not neutral. Like, there is a context towards all of this data that we are seeing coming out there, and you got to look at it with a critical lens, right?
Yeah, no, and it's you just bring up such an important point. I feel myself getting exasperated sometimes, and then I just have to take a deep breath and gather myself, because it's not helpful, right? But as an organization, equity and justice is such a huge pillar of what we're trying to do here at March for Science. And we talk about it in sort of STEM as a whole, who's being represented in research, who's actually getting to do the research and has access to grants and all of these kinds of things. And we can't decouple this conversation either, right? So all of these conversations around equity and justice, of course, public health is a huge part of that. And of course, during a global pandemic, it's also a huge part of that. And, I feel, I try to have some grace with myself and with other people, honestly, because there is so much going on, right, in our personal lives, in our sort of like immediate world around us, and then in the actual global in the world. But I just do hope that people will take a deeper look at what is actually going on before we point to things as successes or not successes or whatever, as we move forward, because we're setting a dangerous precedence if we think that leaving anyone behind is a recipe for success. It's in fact a recipe for disaster.
Yeah, and I think for me, it's sort of just looking at, so I work in this job where people are looking at, what do we call a scientific success and all of that stuff. And it doesn't make sense there's suddenly these borders sort of coming up, I guess, because there's no borders in science when you look at data. And it doesn't make sense from like a herd immunity perspective, from
right.
how you break a chain of infection perspective. And then we're worried about these variants, right? And so it doesn't make sense where people are so closely like living and working in the same area to ignore all and say we're a success. It makes no sense to me.
No, and that is the thing that I often, I am Palestinian. I'm first generation. I've spent a lot of time back home, obviously not in the last year, but I do still have tons and tons of family and all kinds of friends and just lots of people that I work with that are over there. But I often here in the US feel the need to explain just how small the country is. And it comes into play with like political things and economic things and all that. Of course, that's a part of it. But right now, again, as we're in the midst of a pandemic, that tiny slice of land, it becomes even more important how small it is and how closely together everybody is. And even with the walls and all of these other things, it's not, people work on both sides, and there's just all kinds of interaction that that happens or is supposed to happen. And so it's not, even if we are totally crass about it, right? And we remove the human piece of it, which I don't really, that's not who we are. And it's not like we like
Yeah.
to do. But if we're just going to be like super, super crass about it and make it just about like individualism or whatever, you're not safe as another person if the folks around you are not also vaccinated or are not also being afforded access to the care that's needed. And so yeah, I think that's a really important conversation that we have to be really honest about it. There's a lot of really important conversations like this that we sometimes want to sweep under the rug or just push to the side because it's tough, it's difficult, and it is difficult, but we don't get anywhere doing that. And in this situation, again, it's dangerous.
Yeah, and you do say, I just sort of want to bring it. So I'm from Australia, and you do say the thing about like being a small area, and that amplifies it, makes it worse. But Australia is a huge country, and this is coming up in Australia too, because we're in a region, the Pacific, region, where Papua New Guinea is close by, and Australia actually is a problem. It's been seen as this model, and in many ways, rightfully so, for sort of getting infections down and doing the right public health measures, etc. But it also sort of blocked access to vaccines to its Pacific neighbors. And so what they're seeing now is that Papua New Guinea has rising infections, and they don't have enough vaccines to help, the vulnerable people, indigenous communities in that population be protected. And so Australia's had to look at that and really try to scramble to change its policy. But it's just, we cannot just have this narrow focused on vaccine nationalism. We have to see this as a whole systemic thing.
Absolutely. And one of our, I think it was actually our very first Let's Get Vaccinated show featured Alyssa Milano, who's a friend of March for Science, and
Mm-hmm.
has really been working hard on vaccine equity and distribution. And the way she put it, which I just thought, I still think is so poetic and beautiful and simple, is this really is the people's vaccine. We have to view it that way. And there can't be this, we're already seeing this chatter of post pandemic life and it being marked up all these bajillions of percentages, and we just don't, quite frankly, we don't have that luxury. And so I think it's important that we sort of keep that equity lens in sharp focus, or we're in for a world of hurt, unfortunately.
Yeah, absolutely. I want to quickly talk to you about this, and we'll probably address it from a US perspective in a few moments. But I am interested, sort of, when you see this inequity, and I guess, with Israel like looking to send its vaccines to its allies before Palestinians, the people who are most vulnerable in the region. What's the read from Palestinians in terms of trust in the vaccine? Because understandably, when you're denied access to something, when you're eventually given that access, you got to be a little bit skeptical, right? I feel like, I don't know, I get the feeling that it's very damaging from a public health point of view to see politics sort of hijack, this whole process, right?
Yeah, I definitely, I mean, I think it's not quite the same as what it is in the US, but there is
Mm-hmm.
still um, a potential for almost like giving up. It's like, of course, this is what's happening again.
Right.
And so I'm just going to go live my life and do the things I'm going to do because they're not looking out for me. So I'm just going to do what I need to do. And it just creates a further divide, further distrust. It makes it harder. We all want to, I mean, I feel like I was staying strong through this for a very long time, and I'm just like, I'm at my wit's end, as is everybody else. And so we all want to get through this. So it's damaging on so many levels, and there is already distrust there, understandably, similarly to communities in the United States. But this does just further exacerbate it and make it worse and make it harder to center public health writ large for everyone. Because again, we're not there, and you've said it, like, there are no borders. It doesn't matter. It doesn't care. COVID doesn't care who you are, or who you're related to, or where you live, or like, it just, it doesn't matter. So exacerbating the distrust already is just, it's really, it's problematic.
Yeah, absolutely. Before you go, I do want to talk about solutions. We had a great user question actually on how can US and global leadership address equity within local and global communities. So yeah, maybe you can speak to that as a Palestinian, like where's the best way to advocate on this issue?
Honestly, I think there's, like so many things, public opinion moves the needle oftentimes, and knowledge of the realities that are happening in Israel and in among Palestinians and in Palestine, that's really shining a light on the truth, is such an important piece of this, because there is so much misinformation. And then forget the misinformation, there's just a lot of lack of understanding of what's actually happening there. So taking the time to maybe do a little bit of research, share with your community, whether it's on social media or family or friends or what have you, just really bringing it to the forefront so that folks can have an honest conversation and people really know what's going on, and we can force our global leaders to do the right thing. I mean, this is true around the world, but it's not lost on Israel as well. I mean, they dare I say, I'm going to get myself in trouble, they're afraid of public opinion. And so it'd be great if everybody just sort of, pushed in the same direction and remembered that, Palestinians are human beings too, and we have family, loved ones, and that we love and care about. We live our lives like many other people, most other people do.
Absolutely. Thank you so much. It was so great having you on today and for you to share this really important perspective. And it's always great speaking to you, Rania. Thank you so much.
Thanks, Lucky. Always love being with you. See you soon.
See you soon. Thank you, Rania. All right. And on a related note, the WHO is also working on this, speaking about solutions. They actually have a declaration, which we, as the March for Science, are signing on, called the Vaccine Equity Declaration. And as the Director General says, the world is on the brink of a catastrophic moral failure, and the price of this failure will be paid with lives and livelihoods in the world's poorest countries. And so their scheme that they're trying to put pressure on world governments is to help provide vaccinations for roughly 20% of the population of the most of low-income countries and the most vulnerable countries in the pandemic. So we'll drop a link in the chat, and please feel free. It's for individuals to sign on as well. Okay. I'd like to move on to our next guest, Dr. Asha Shajahan. Hi, how's it going? Can you hear me? We'll come back and do a sound check in a second. Thank you. All right, let's try this again. Hi, I think we can hear you now.
Can you hear me?
Yes. Welcome to the show. Thank you. Live TV, right? Live streaming.
Yeah. Wonderful. Thanks so much for having me. I'm really excited to be here.
Yeah, so excited to have you here. And yeah, you are a family and community doctor in Detroit, right? And one of the lead organizers with our wonderful partners. This is Asha. I'd love to hear actually about your work before we sort of dive into all the stuff about the pandemic. What is a family and community doctor? Because, you know, you do interesting things, like you're not always just in the clinic, you're teaching dance classes and doing these wonderful things, right?
Yeah, absolutely. So I'm a family and community physician, which basically means I'm out in the community. So you will see me behind the walls of a clinic or a hospital, but most of the time I try to go out to where the people are, where our patients are, where people live. And that's essentially what family and community medicine doctors do. They're out in the community. So, you know, like you mentioned, you know, I do teach dance classes out in the community, more so before COVID. Right. And now we have got something going on Zoom, not quite the same. But, you know, doing things like walking with my patients, out going on walks, doing yoga with my patients, doing grocery shopping with my patients. I mean, kind of like being out there and really understanding what the social determinants of health are, which is really like our social circumstances and how they influence our health, and really meeting patients where they are. So part of my work is I do clinical, you know, 2 to 3 days a week. And then I also do a homeless outreach and teaching with residents. And so that's, you know, doctors that are coming to close to their graduation time. And we really just work with vulnerable populations. I'm also the GMA Director of Health Equity and Health Disparities. And so in that role, I'm really teaching most of the residencies and fellows of a 8-hospital system in Metro Detroit about the social determinants and about the fact that, you know, what we do in the clinic is really only like 20% of what makes you healthy. And really it's more of a global picture of health, of like where you live, our social circumstances, you know, all of those things kind of really influence our health. And so that's sort of what I do. And I do a lot of work with vulnerable populations as well.
Yeah, thank you so much for your work. It's really so inspiring. And when we were, you know, scheduling this episode, you know, we thought, and arranging it with you, you're really just the perfect voice for this episode when we're talking about, you know, with your focus on health equity and disparities. So it's really wonderful to have you on. And on that, I'd like to, you know, before we sort of begin, I found a great Wall Street Journal clip of you. I'd like to show that, a bit of that to the audience, to show your work during this pandemic.
Sure.
Hey, Dr. Asha here. I'm getting ready to go to the Pope Francis Center.
Dr. Asha Shajahan is a family medicine physician and medical director of community health at Beaumont Grosse Pointe.
I think I'm good.
She's been treating COVID patients via telemedicine and volunteers 3 days a week at the Pope Francis Center, a homeless service provider in Detroit.
About to get started with my day. Feeling better now, right?
Dr. Shajahan screens patients for COVID-like symptoms and, if necessary, refers them to a city facility where they can isolate and receive further medical attention.
We need to take care of everybody, and if patients don't have the ability to get screened, then they're potentially spreading it to others and putting themselves at risk.
We know that poverty and health go hand in hand. Many of the patients that I see, they already have asthma, they already have COPD, they already have mental health issues. So having the anxiety of COVID, in addition to everything else that's going on, puts them at higher.
Yeah, that's fantastic. I really love that short piece of you. I'd love to hear about, you know, your experiences during the pandemic, you know, in the work that you were doing and how you're seeing these disparities that you've always, you know, been working on sort of play out, particularly in the pandemic.
Yeah, so as I mentioned, I've been doing work in this space for quite a while. And so when the disparities started showing up, especially with the racial inequities with the African-American population, I think there was kind of a shock going around, as in like, what's going on here? Like, what's happening? But from my lens, I was like, this is not surprising. And the reason it's not surprising is because we know that our social circumstances really do influence our health. So for example, like with that clip that you saw at the Wall Street Journal, that was outside of the Pope Francis Center. So the Pope Francis Center is a place that does homeless outreach where we have clinical operations and we also serve meals. So when the pandemic first hit, everything just shut down. So suddenly there was no shelters, there was no place for people to go. And then when you're thinking about telling the public, wash your hands, stay home, stay safe, as a homeless person, if you don't have a home to stay safe in, what are you going to do? If you don't have access to wash your hands or have hand sanitizer, what are you going to do? So I think already just in the very beginning, if you just even look at like vulnerable populations such as the homeless, it was already a discrepancy when people are saying, this is how you protect yourself from the virus, right? And a lot of people don't have the resources to do that. So I think when we look at inequities in health, and particularly COVID, when it comes to things like what you can do to keep yourself safe, and now when we're looking at the vaccine rollout, there's a lot of inequities playing out.
Yeah, absolutely. And that messaging component is so important, right? Because I think sometimes the one thing I do here is that like the virus doesn't discriminate, doesn't matter who you are or like how much money you have or whatever. And I sort of get where that messaging comes from, but it's patently not true because, the conditions, you exist in do affect how likely you are to get it and the resources you have to protect yourself from it and the health outcomes that happen if you do contract it, right? And black and brown communities patently have a much higher risk. And when we navigate through this pandemic, we need to understand that and work around that, right?
Yeah, absolutely. And I think especially when it comes to the vaccine rollout, I think we really need to pay attention to the vulnerable populations. And the vulnerable populations are not only the elderly, although that is an included group, especially when you look at the fact of the way things are rolled out. And so I think and I'm sure we'll get into that more in detail, but I guess like, for example, if you're just even looking at the technology behind the vaccine rollout, especially in the very beginning of the vaccines being introduced, it's like if you couldn't get online, if you didn't know how to navigate email, if you didn't have time to keep checking for appointments, you're most likely not going to get one. So I think we have to really look at what are the obstacles that people have and what are the communities that have been affected by COVID the most? Who are the vulnerable people that are actually dying from this disease and who are being hospitalized more? And how do we reach that population?
Absolutely. And when the vaccine rollout was just starting, I remember being on Twitter and sort of seeing one of the big gaps, of course, is that sometimes we don't have data on this, on, the communities who are getting vaccinated. And we need that data to be able to, act in those ways to ensure equity. So one of the places data was coming out from early was Chicago, nearby to you. So I didn't have the Michigan data. Maybe you can update us on that. But I saw, Chicago VaxBot, which is run by a local paper in Chicago. I kept seeing these maps. They were tweeting out these maps every day of one on the left-hand side, a map with, the zip codes of who is dying, who has been most impacted by the communities most impacted by COVID, and who was getting vaccinated. And of course, Chicago, as a lot of people know, it's fairly segregated in terms of demographics. And so you see people on the north side on that map are the ones who are getting vaccinated, but the communities who are being infected are on the south side. And so the Union of Concerned Scientists sort of took this one step further and, they mapped out the census block, right? And so as you can see, Black communities on the south side, that's where they're at. But when you look at vaccination sites and where they are, they're still more highly dense on the north side. So, I thought that was a stunning sort of representation on what is playing out all around the country, right? Yeah, maybe we could talk about that a little in sort of that inequity in vaccine distribution. How did we get to this point where that was happening when we've known for a year which communities it's been affecting? Like I'm very frustrated, and many people are, to see that this is playing out in this way.
Yeah, I think that in the very beginning, there was just a lot of confusion as to how to do this and what's the best way to do it. And there was a lot of focus on healthcare workers. And so it was a lot easier to distribute vaccines in a hospital setting or like at the hospital campuses, because that's where most of the healthcare workers were. So I understand that piece, but I do think we have evolved quite a bit. So actually, the Biden administration has put forth a health equity task force. And there's about 44 states now that are reporting data regarding the vaccine based on race and ethnicity. So that's really reassuring. In addition to that, I think, as I said, initially, it sort of seemed to be a few sites that was mostly hospital-based. But I think now many more places, especially with the J&J vaccine, I think that's a game changer because of the fact that it's more easily transportable. It can be placed in a regular refrigerator. You're now able to see that this vaccine is going to be available at churches, at community centers, and pharmacies. And so here in Michigan, we do have it available at our major health systems, but it's also available at many of our local pharmacies, as well as community centers, and people can apply to be vaccine sites. And so I think all of that has really helped, but I think, it's always easier to say we're not doing enough, which we can always do better and we can always do more. But I think the importance is that there has been a recognition that, hey, like that map that you showed us, what's going on? And as soon as that has come to our attention, immediately we're trying to get out there and take advantage of what we have as resources to help people in those communities. And I think that's also something to keep in mind too, is that a lot of vulnerable populations that were adversely affected by COVID, there's more than just vaccine distribution being an inequity. Some of it has to do, like you said, with messaging and trusted messaging. People in those communities are vulnerable for a reason. They have a lot of distrust towards government. A lot of injustices have occurred in their communities. And so there is some vaccine hesitancy happening as well. So if you look at like the main reasons why we're having trouble with the vaccine is like, I think of things such as, one, transportation issues. So if you're not having a vaccine site that's nearby, or you don't have a car, if it's a drive-through, I mean, that's going to be a disparity right there. Second thing is the amount of time people need to have. So if you're working full-time, or you're working in Detroit, like on one of the assembly lines, you're not going to have time to sit on the phone, even if there's a phone line, or sit online and keep refreshing your screen. And then that's part of the tech issue. So if you're not tech savvy, that's a problem. And then the thing that I was trying to emphasize here is trust. If you don't have trust, it doesn't matter if the vaccine's available to you. A friend of mine was living out in North Carolina in one of the communities of Native Americans. And he told me that they had access to vaccines in that particular community, but many people weren't taking them. And so part of the effort of having equitable distribution really has to go with being able to have trusted messengers that people can have their questions answered, their concerns answered about this vaccine. And only then will we be able to reach all of the populations in an equitable way.
Absolutely. And I guess on that, sort of thinking about, we had a great question from our audience on trust and building trust and having the right messengers. What if we get the wrong messengers? So they asked, what role does misinformation, disinformation play in terms of equity and access? And I know I have relatives in Minnesota, so this played out before the pandemic, right? And sometimes anti-vaxxers, they target vulnerable communities. I know Somali immigrants in Minnesota have been targeted before. So, how do we counter that role that disinformation is playing when we're trying to talk to our communities?
Yeah, so misinformation and disinformation play a huge role in terms of vaccine hesitancy. And like you said, these messages are targeted to people that are already kind of distrustful, already sort of on the fence. And so what we can do as people who are, with science, or people who understand, like, for example, a healthcare provider, a physician, is to build trust with our communities that we know that we are trusted messengers. So for example, I had a patient actually just today, is a true story. She came in and she said that she thought the virus was made up, and she came in wearing a mask and was doing all of the things that she was supposed to do. But when I asked her if she was going to get vaccinated, she said, absolutely not. Why would I do that? And so I took that moment just to ask her, why is it that you feel that way? And she kind of stumbled around a little bit, and she said, well, I don't trust the government, and I don't trust this. And then I asked her, I said, do you trust me? And she said, well, of course, doctor, I trust you. I come here for my healthcare all the time. And I told her I got both doses of the vaccine that I was offered. My parents were vaccinated. My uncles and aunts were vaccinated. People in my community were vaccinated. And she kind of paused for a minute. And what she asked me at that moment was, okay, I'll take the vaccine, doc, if you give me the vaccine. And so that was a point where I'm like, okay, we really need to get this J&J out there in the primary care clinics, because that would have been a moment where I could have offered her a vaccine and she would have been vaccinated. But unfortunately, currently in our state, in my current system, we don't have those vaccines available to give at that point. So I think, again, if the message is coming from within your community, within people that you trust in your community, and when people do read things that are false, they may not know that it's false. And so having more discussions, and if someone brings something to your attention that you believe is false, is to say, where did you get that? What's the source that you got it from? I think United Nations has a campaign called the Verified Campaign. And the first part of that Verified Campaign is to pause, right? Pause and look at the date of the article. Look at who published the article. Is there an about us? Are they part of a certain affinity group? Are they biased in some way? And also before you start sharing these sensational news stories, it's make sure you read the whole article. A lot of times you'll say, so-and-so had a terrible, so here's another example. There was an article that stated that a patient had, an adverse reaction to the vaccine and ended up in the hospital, had a seizure or something minutes after the vaccine. But then when you read through the actual article, it's the patient had already had multiple issues with seizures in the past, and it was maybe something chronic. So you just read the headlines a lot of times, then it instills fear and people don't read through the entire document. So I would say just if you are reading news articles or posts online, verify and see if it's listed multiple times in different resources. If it's a true fact, it's going to be on all the news networks and just not some and not the other.
Yeah, absolutely. Those are really great tips. And I think something that you mentioned, and I think sometimes people sort of, I guess, I get wrong about science communication. So my day job is in science communication. I train a whole bunch of amazing scientists, physicians, researchers to talk to the media, and they're all fantastic at it. But I think people always think of it as it's just about how well you talk. And I think a large part of science communication is about listening, is about hearing those concerns, is about being patient, right? And so it's not anything that even comes out of your mouth. It's being there to hear and listen. And I think it's something that physicians do really well, right? In your everyday job, is sort of listen to your patients, hear their concerns, and work from there.
Yeah, active listening is key. And even with your friends and family, if someone is really resistant and you're trying to convince them of something, that it never works when there's that dynamic, that polar dynamic. It's always better to listen with compassion and say, why do you feel that? Why do you believe that? Because most of the time people believe things because they've been told things. And so if someone's trying to tell you that what your belief is wrong, you're going to be very defensive about it. So I always like to offer other resources to read to people, and then just keep talking about, who are the people that you do trust and what is it that they're saying? And then how can we come to a happy medium? And sometimes it's going to take more than one conversation. In fact, a lot of times it takes more than one conversation.
It does, doesn't it? That's true. I think this is a sort of a good point to sort of talk about your work with This Is Our Shot, because I know your network is doing wonderful things in terms of communication and sort of organizing your communities. So yeah, tell us about your work with that.
So This Is Our Shot is a grassroots campaign, if people are not familiar with it. And really what it's about is empowering healthcare leaders or messengers or our trusted heroes to be able to give the facts, to be transparent, to answer questions, to combat misinformation, and really be the voice that's out there to help people sort through this pandemic. We really want shots in arms, and that's because we want a COVID-free world. And that's really the only way we're going to get there. But we understand that people are hesitant, people are scared, people have questions, and that's valid. Everyone should. But the purpose of the campaign is to really empower people to get out there, things like what you guys are doing here today for March for Science, is having conversations. The more people that you hear talking about it, the more people that you have opportunity to answer questions. We've been doing Facebook Lives or Instagram Lives where, our families and friends can ask us questions about the vaccine. I mean, I get about 20 to 25 questions a week in my messenger chat of people just saying, hey, I'm about to get the vaccine. Should I take Tylenol before or not? Or, my dad doesn't want to take the vaccine. What do you think I can do to help guide him? These are just questions that we have. And obviously everyone may or may not have a family doctor or a person that they talk to, but they can't just ask the on the spot questions. And so that's really what we're here for, to help empower people to learn more, make informed decisions, and to get us to a COVID-free world.
That's so amazing. And thank you so much I've enjoyed this conversation so much with you, speaking of conversations, and it's a really important part of, helping keep each other safe at the moment. So thank you so much for your work and so much for joining us on the show today.
Yeah, thank you so much. And we're going to have to talk about messaging. You're going to have to teach me what you teach everybody else. So thanks.
Oh, you're a pro. Likewise. I look forward to talking more about this, and yeah, see you soon. Thank you so much.
Yeah, thank you.
Bye. All right, and on that note, in terms of amazing outreach and having conversations in our community and sort of helping increase access to vaccinations and vaccination site, I'd like to talk about sort of this week's Fauci fave, where we highlight a great piece of messaging every week or a great action which helps our communities get vaccinated. And so for this week, I was actually walking around my neighborhood in Brooklyn, and I came across a local bodega where I saw this sign come on. And it looks, like those signs where you want a guitar lesson, you sort of take a tab to sort of, get a guitar lesson, or it looks very similar to, when you're organizing an electoral campaign and you want to get the vote out, you tell people where voting sites are. So I thought this was just a wonderful, simple piece of outreach and sort of talking about the difficulties people are. And I get these questions all the time in terms of where can I get vaccinated, where my local site is, because not everyone has equal access to online resources. And so, one of the things that you can do is figure out how to do outreach to your local community. And often it's simple things like putting up signs around your community. Maybe you want to ask your neighbors, would they like to get vaccinated? If they're an eligible category, can you help them? And it's wonderful things like this. So for that, this piece of wonderful outreach gets of the week. All right, and what we also like to do every week is to leave a prompt, a boost of the week. And this week's boost of the week is, what will you do to help improve vaccination access and equity? #vaccine boosters. So please, in terms of helping each other get vaccinated, it's important that we keep visibility, we keep amplifying, the work that's being done, we keep having these important conversations. And so every week we leave you with a prompt to tweet on social media, to put out there into the world, to sort of help show that this is a collective effort. And so please put that out, tell people what you're doing to help improve access for your community. And of course, on that note, we have a big announcement to make, and that is our vaccine boosters training as part of this Let's Get Vaccinated series. We have a date, and it will be on Wednesday, April 21, just before Earth Day. And we invite you to sign up. We'll put the sign up in the link. And this is part of this series. As we say, one of the most important things we can do is to have conversations about vaccines with our community. And so at that session, we would love to have you there, and we will bring a whole bunch of experts who can tell you about what's the messaging, how do we address concerns, how do we see. We'll give you all the good stuff to have those full productive conversations with your community. All right, and before we wrap up tonight, I do want to talk specially about the incident and tragedy in Atlanta this week. First of all our love and solidarity goes out to the victims, their families, and the Asian American community. This sort of tragedy has been shaped by an intersection of identities: race, gender, class, immigration status, and we must all speak up and take action against white supremacy and misogyny. Now, as an Asian scientist, I'd really like to highlight the connection to science, and I work here at the March for Science. So 1 year ago, former President Trump called the virus the China virus. And it wasn't only politicians that have been using problematic words. We scientists have been naming viruses and variants after their places of discovery without deeply considering the impact on marginalized communities. Studies show that there has been a surge in anti-Asian violence over the last year. Now, that can't be a coincidence given how words have been weaponized during the pandemic. Racism is an issue of science and justice. We scientists and science advocates must be vocal about it. So whether it's advocating for vaccine equity for Palestinians, fighting the disparities that Black and Brown communities face in the US, or standing up against anti-Asian hate, these are all science issues, and they are core issues of our movement for science and justice. We need to remember that the pandemic doesn't just end when we get vaccinated. The pandemic doesn't just end because our own safety is secured. No one is safe until everyone is safe. We must keep fighting for the safety and liberation of everyone. Thank you everyone for joining us, and you have a wonderful, wonderful night. And we'll see you next Thursday.